I'm Summer Rieke, and my husband's name is Brandon, and we have 4 kids. The first thing that comes to my mind when we talk about Sloan is sassy.
She has always gone to the beat of her own drum. I think she would wear a beautiful ball gown every day to school if Mom would let her. She is the princess, and she would want everyone to make sure that they see that every day.
When I was pregnant with Sloan, everything was right on track. We had no concerns, and then the day came to have her, and everything went really, really well that day. And our pediatrician had came and did, the newborn exam, and she did hear a heart murmur, so we'll just kind of keep our eye on it. So at our week appointment, we went back, and she did hear the heart murmur again, and just said, I don't think it's anything again, but I want to go ahead and document it. So if you guys could go to Children's and get an echo, and that way we can have it in our records. My husband was out of town for work, and my dad drove me. I wasn't nervous about it or anything. We went up and had her echo, and our pediatrician walked in, and you could immediately tell something was wrong. And she said, I just want to tell you everything's okay. Your daughter's going to be fine, but she is going to have open heart surgery. And I immediately just hit a brick wall. Again, my husband was out of town, so thankfully my mom was there with me, and just everything kind of blacked out. And she said, I already set up an appointment with Dr. Fletcher. He's gonna be your daughter's cardiologist. You guys are gonna go up there in about an hour. I called my husband, and I couldn't even talk, and I just told him, Sloan has to have open heart surgery.
Feeling Summer on the other side of the phone and hearing that emotion was something that will stick with me forever. There's no easy way to get immediately to your family.
You immediately think, what did I do? I thought of everything from what I ate, okay, well, I ate a turkey sandwich. Is that something that messed up? Or you immediately think of everything. And Dr. Fletcher immediately grabbed my hand and said, this is nothing that you did. This just happens.
So we did an echocardiogram, and that echocardiogram led to her diagnosis of a variant of tetralogy of Fallot. Kind of my way of doing things in the clinic is to draw pictures on the whiteboard. So I did that for them and explained that this was significant congenital heart disease, that we'd be in need of surgical intervention. The patient kind of sets the tone as to when surgery is going to be, but our ideal would be to try to wait till she was at least 3 months of age or so if we could.
It's a lot to take in, especially, again, when you have 3 other healthy kids. This doesn't even cross your mind. Everything that she did makes you extra worried. Is that breath off? Is her heart beating too fast? Is, anything like that. We would wake up and just be well, it could be today, it could be tomorrow. We were unsure, so it's very stressful.
I was in the military and a couple of tours overseas, and there's still nothing like having your child be put in a scenario where you don't know the outcome.
We went up to meet with her surgeon, who was amazing, Dr. Ali. We love him so much. He immediately walks in the room, and he doesn't even talk to Brandon and I. He just walks over to Sloan and introduces himself. Sloan was 4 months old at the time, and I immediately looked at Brandon and I was like, yes, that's a big heart right there.
Every single time I'm going to the operating room, I still feel just as worried as I did my first operation 6-7 years ago. And I still feel the same joy every single time I receive a postcard from a family or I see a family in my clinic after they've recovered from their surgery. We can treat this condition, and we can treat it well.
And then I remember just watching the clock and it getting closer and closer to surgery time. And I wanted the clock to stop. Because having to hand your baby over to somebody that you've never met and just hope that everything's okay is a lot. So they did prepare us and said, it's kind of alarming when you go back there. She has all these lines coming in and out of her. And so just be prepared. She's not going to look like herself. But I was just so happy to see her and see that she was okay.
That was good.
You saw it.
So amazingly, Sloan was only in the hospital for 3 days. She was a rock star.
Sloan's got this for life, right? But the good news is there's such a community of folks and professionals that are driven to help this and focus in this area. And it could be these next advancements and breakthroughs and make it that much easier to do what's necessary for her.
I'm putting my ears on.
Before this, I didn't know a ton about congenital heart defects, and now I have made it a big purpose to make sure that I advocate. We need to continue to advocate and to show and to learn those things so that kids down the road can have a better life and don't have to be backed into corners of continuous surgeries.
Seeing patients like Sloan is really the main and most important motivation why I get out of bed every day. And it really helps me to see that every day, every week, all the time.
The American Heart Association, for my wife and I, have really shown us that we aren't alone, and that we're not doing this alone, and that Sloan will never be alone.